Thank you for joining the American Association of Kidney Patients for our 45th Annual National Patient Meeting. My name is Dale Rogers. Since the age of 12, I have managed kidney disease. Throughout my journey with kidney disease, I've received 2 kidney transplants and survived 8+ years of in-center dialysis, as well as peritoneal dialysis. I've gone through many of these treatment options while also achieving a professional career in managing for a national food chain as well as an IT specialist for my local county. I am humbled to serve AAKP as both National Ambassador and the member of the AAKP National Board of Directors. I'm humbled knowing that I am part of the oldest and largest kidney organization in America, helping make a difference for each and every patient suffering from kidney disease. Today, I am pleased to introduce Dr. Wendy St. Peter. Dr. St. Peter is a strong patient advocate and ally of AAKP. She is a professor in the College of Pharmacy at the University of Minnesota. She received her Doctor of Pharmacy degree from the University of Texas Health Science Center, where she also completed a fellowship in adult medicine. Dr. St. Peter's career has been focused on improving medication management and drug safety in patients with chronic kidney disease, CKD. To improve health outcomes, she has served on several national technical expert panels for the medication-related safety and quality measurement issues. AAKP strongly supports Dr. St. Peter and her current research related to new models of care for kidney patients, as well as treatment of kidney-related anemia, mineral and bone disorder, and the intersection of management of heart failure, CKD, and acute kidney injury. AAKP believes Dr. St. Peter is focused on an unmet need for patients. The pharmacist as a center member of the patient care team. It is now my pleasure to welcome our AAKP friend and ally, Dr. St. Peter.
I want to thank AAKP for inviting me here today to talk about optimizing medication management through use of a pharmacist and being a pharmacist being a part of your team. I'm Wendy St. Peter. I'm first and foremost a pharmacist, but I'm also a professor of pharmacy at the College of Pharmacy, University of Minnesota. When I first got a job out of pharmacy school, I became part of a medical team at Hennepin County Medical Center in Minneapolis, where I worked with kidney doctors and nurses and social workers and dietitians with dialysis patients, transplant patients, and patients that had chronic kidney disease. So today, again, I want to focus on a clinical pharmacist. I am a clinical pharmacist and making a clinical pharmacist part of your team. So your healthcare team might look something like that is on this slide. Most of you probably have a primary care doctor, have a maybe advanced nurse practitioner instead of a primary care doctor. You may see specialists, so you have a kidney doctor, a nephrologist, you may have a diabetes doctor. You also probably see several community pharmacists over the years as you pick up your medications and maybe are counseled at the pharmacy. If you have chronic kidney disease or transplant or a dialysis patient, you probably also have a dietitian, maybe a social worker. Certainly, if you're in the dialysis unit, you have a dialysis care team. But there's one person that is missing from this slide, and I want you to give some thought about who that person is. Person is a clinical pharmacist. What I want to talk about is what a clinical pharmacist is about. So the things we're going to discuss today is how a clinical pharmacist can help you and your care partner optimize your medication management along with the rest of your healthcare team. And then how you and your clinical pharmacist can help your healthcare team stay on the same page as far as your medications. And lastly, because there's not enough clinical pharmacists to go around yet to work in the dialysis and transplant area, I want you to help me help my team advocate for advancing American kidney health through optimal medication management. So I want to talk to you about different types of pharmacists. And the first pharmacist is a community pharmacist. As I spoke to, you've all probably seen a community pharmacist at one point or another. In the traditional community pharmacy, oftentimes there's no private counseling section. The pharmacist oftentimes will counsel you on new medications, may not look at all of your medications to see if it fits in with the rest of your medicines. They may do a drug interaction check, but those are kind of the traditional things you see in a traditional community pharmacy. Now, we also have pharmacies that have extra enhanced services. These pharmacies typically have private counseling spaces, as you can see on this slide. They may actually have a private counseling room. They may do a process called medication reconciliation. If they have access to and knowledge about all your medications, they can sit down now with your new medication and make sure it fits into the medicine regimen you're already taking. They can also help you with medication synchronization, which means you can come in at one time and get all your medications at once instead of having to go to the pharmacy multiple times a month. They can do immunization, some do blood pressure monitoring, and those pharmacies that are connected and typically with health systems may actually do a comprehensive medication review on you, looking at all your medications, all of your conditions, and prepare a personal medication record. The problem is that community pharmacists face barriers to providing optimal medication management. There's oftentimes not enough time to counsel in a busy pharmacy. Most community pharmacies don't have access to your full medical records, so they don't know sometimes all of your drugs, and they don't know all of your conditions or your diseases. So they can't provide comprehensive medication management. And what do I mean by that? That means they take a look at all of your diseases or conditions, they look at all of your medications, and make sure that all those medications make sense together in the treatment of all of your conditions. So I want to ask you, have you had one of these medication therapy problems? Have you ever had a situation where you don't know why you have taken so many medications? The medication didn't help you? Have you had side effects from one or more of your medications? Is there a situation where you couldn't get a medication you needed? Either your formulary didn't cover it, or you may not have been able to afford it, or you may just have such a long medication list that you don't know how each medication helps you. So if you've had any of these medication therapy problems, I want to talk to you about a clinical pharmacist. So what is a clinical pharmacist, and what can a clinical pharmacist do for you? I'm going to show you a video clip of one of my colleagues, Dr. Sarah Westberg. She is a highly trained pharmacist. She's had 4 years of pharmacy school, plus she's done a residency in pharmacy, and she practices with patients that have high blood pressure, diabetes, high cholesterol, and she specializes in women's health. And I'm going to show this because she can tell you better than I can do and demonstrate what a clinical pharmacist does.
Many people think that pharmacists don't work directly with patients, and that's just not true.
Dr. Westberg helped me crack a problem that I had where I couldn't quite get a good habit going. I've been seeing Dr. Westberg in the clinic 3 or more times a year for over 8 years. And then I roll up the napkin with my breakfast pills.
I've been happy to be part of that journey with you and help you making sure all those medicines are working and appropriate for you. Every individual person approaches medicines differently.
Because all of these are different aspects of my healthcare.
Pharmacists bring that clinical expertise and the science background, but we package it to really personalize and contextualize all the decision making that happens.
The conversations we have are about lifestyles and changes that could be made outside of just taking the meds. So you develop a personal relationship.
Dr. Westberg actually had to phone me, and she had some poor news for me. The manufacturer of my infusion medicine was no longer going to manufacture that medication. That was a pretty significant crisis point. Had it not been for Dr. Westberg, I don't know that I would have been able to engage in a good problem-solving process.
The fact that pharmacists are spending a lot more time doing direct patient care becomes an incredibly fun option when thinking about a career in healthcare. It's all of us that make up this care team, and then we each bring something to the table, something to the perspective through our own lenses. And I think that collectively that's so much better than if it's just one pair of eyes looking at a patient.
We definitely provide a different perspective when we're meeting with these patients, making sure they're on the right drugs for a reason and they're using it safely and appropriately.
Having someone come back and say, that was so valuable and you helped me with the daily things, you helped me get on the right medicine to solve this medical condition, is really rewarding.
I hope that this video clip helped you understand what a clinical pharmacist does. You can see that Dr. Westberg wasn't in a pharmacy. She operates out of a clinic in one of our health systems, and all she does every day besides teaching pharmacy students is meeting with patients and solving their medication therapy problems. So clinical pharmacists are there to help you solve your medication therapy problems. So what am I talking about? When a clinical pharmacist meets with you, they're thinking of 4 major things. 1, is the drug indicated for you? Meaning, do you need it? Do you have a reason to have it? Because there are so many times when patients are taking unnecessary medications. They may get started on one and then nobody stopped it. They also take a look to see if you have a condition that actually could be resolved with the medication. Secondly, they look to see if the medications that you're taking are effective, meaning do they work for you? If they're not effective, they can help your physicians or to put you on a new medication or change your dose if the dose is too low. Or if it's something that we want to check, for instance, is it helping your kidney function? You may need long-term additional monitoring to check your kidney function tests. The other thing they're always as foremost in their minds is your safety. We don't want you to have adverse medication reactions or side effects, but the fact is drugs have side effects. And so what pharmacists can do is help you understand what are the most common ones. What are those that are going to be most important for you to be aware of, and then what to do if they occur. That's really important. They can determine if the dose is too high and maybe we need to back down, or again, you may need additional monitoring. And lastly, and most important, is an adherence piece. Medications don't work if you don't take them. And so there are many reasons why people don't take their medications. Sometimes they're too costly. Sometimes they feel like they're not working, and so they decide to stop them on their own. Or they may be having side effects. They may cut down on a dose. Those are the kind of things that clinical pharmacists work for you. They look at your goals for your life, your lifestyle, and help you develop a medication plan that works for you so you can adhere to the medications that are important for you to take. So my message to you is that a clinical pharmacist should be a part of your team. They're trained to find and help you solve your medication therapy problems. They're also trained not just to work with patients, but to intersect and work with other healthcare team members, and not just behind the pharmacy counter. So the key is they can help you with all the medications that are coming from different doctors and make sure that everybody knows what you're supposed to be taking, and they can check with your other doctors to make sure that they know, of what you're taking and the problems that you're having. I also wanted to know, I think as you're getting a sense when I'm talking about community pharmacists and then clinical pharmacists, that there are pharmacists that have different levels of knowledge of chronic kidney disease and of basically drugs in general. And it's just like with doctors. Some have additional training and specialty training, and so do pharmacists. And specifically as it relates to dialysis and kidney transplant. So if you are either a dialysis patient or a kidney transplant patient, have you had any of these medication therapy questions? So what is the best time to take my blood pressure after dialysis? Sometimes it's really hard to control blood pressure when you're on dialysis and with the dialysis process. Or if you're a transplant patient, have you had the issue where your insurance company wants you to switch your transplant immunosuppressant to a cheaper generic? Your question is, should I do that? Is that safe? Or maybe you've been in a situation where your diabetes doctor prescribes some diabetic medications, your nephrologist or kidney doctor prescribes a different medicine, your primary care physician wants you to stop taking one of the medications that your diabetes or nephrologist has prescribed for you. What do? Well, this is where it's very helpful to have a pharmacist that's specialty trained in working with patients with chronic kidney disease, dialysis, or transplant. So I want you to meet a specialty pharmacist. Dr. Tracy Anderson Haig is another one of my colleagues, and she specializes in kidney transplant. She also sees patients that are on dialysis and chronic kidney disease as well, but her expertise is really in kidney transplant. So I want you to hear from this video clip what Dr. Tracy Anderson does each day.
Hi, I'm Tracy Anderson Haig. I'm a clinical pharmacy specialist in kidney transplantation. I work at Hennepin County Medical Center in downtown Minneapolis, and this is a day in the life of a pharmacist. So when people ask me about my job as a pharmacist, they often assume that I work in a community pharmacy and are shocked to find out that I actually work in a medical clinic with a scheduled appointment, seeing patients directly like a physician would. I take care of patients anywhere from 18 years of age to over 80 years of age, starting from the time they get their transplant, sometimes even before, and I'll be primarily caring for that patient. It is extremely rewarding to be able to work with patients and see a difference that you're able to make to ensure that their medications are used properly. Be able to find a medication that's causing an adverse effect, suggest an alternative medication that may work as well without the same side effect, and have that patient come back a month later with the problem resolved and the medication effectively treating whatever condition it was there for. And the patient actually recognizing that it was you, the pharmacist, who made a difference and improved their quality of life. Because I work in transplantation and transplants can occur at any time of day or night, I'm functionally on call 24 hours a day and 7 days a week. Sounds daunting, but it's very rewarding to know that I'm an integral member of the team and able to help out when they need assistance with medication management of these patients. One of my favorite patient experiences was a patient that I'd seen in clinic for the first 3 or 4 years after her transplant. And I always chuckled when she came in because on her drug allergies it listed blue M&Ms. She was doing very well after transplant, but then was admitted to the hospital 3 different occasions in a short period of time with nausea, abdominal pain, kind of non-specific complaints. And then I remembered the blue M&M issue and thought maybe this is a problem with blue dye. So I went to the hospital and asked her what her symptoms were when she ate blue M&Ms, and she said they were sort of similar to what she was experiencing now, but she hadn't had any blue M&Ms recently, so that couldn't be the case. I then called her retail pharmacy, and sure enough, there was Lake Blue number 1 and number 2 in that pill. So we worked with her local pharmacy and got rid of all medications that she was on that contained blue dye. And about a month later, I got Paige to come to clinic, and it was the patient. She said, "I just had to give you a hug. I eliminated blue dye completely from my medications and my diet, and I feel like a completely different person." That's why I'm a pharmacist, is to hear responses like that from a patient and know that I've made that kind of difference and impact on something that seemed like a very small, long shot intervention that was life-changing for my patient.
I hope you can see from this video clip that Dr. Tracy Anderson is very similar to, to what Dr. Sarah Westberg does. They both work in clinics. Tracy just happens to have a specialty education in the area of transplant and dialysis. So she knows specifically about those areas. So the sad fact is that we don't have enough pharmacists across the country that have expertise in chronic kidney disease and dialysis related medications and transplants as well. So what I'm going to tell you next is what you can do right now to make sure you're managing your medications well. First, you should request to have a pharmacist review all of your medications, not just your new medication, but all of your medications. If you have a primary care physician, you may have a clinical pharmacist that's available to do that. In Minnesota, we have about 100 pharmacists across 15 different health systems that work in clinics, and that's all they do all day, like Dr. Sarah Westberg or Dr. Tracy Anderson Haig. They sit down and work with patients to solve their medication-related problems. And if you have that opportunity, you should advocate for that. Regardless of what pharmacist you see, or if you don't have a pharmacist, you're seeing your doctor or your nurse practitioner, make sure you bring all your medications to your visit. That means your prescribed medications, anything that you're taking that we call over-the-counter medications, things like aspirin or non-steroidal anti-inflammatory agents like Aleve or Motrin. Those medications can lead to some kidney toxicity, and it really is important for your pharmacist and your healthcare team to know that you're taking them. Also, I hear many patients say, well, I'm taking vitamins and herbal medications or dietary supplements. Those don't really count as medications. All of those have effects on your body, and they may interact with other drugs that you're taking. So you need to include those in your list so your healthcare team knows everything that you're taking, not just your prescribed medications. So what are the steps that you can do to improve your medication use? First, you should bring your medicines with you each time you meet with a pharmacist, doctor, or nurse to review those medications. So make sure you bring them in and you let them know everything that you're taking. And step 2, let them know exactly how you take each medicine. I'm always surprised when I'm talking to patients how reluctant they are to tell their physicians that they're not taking a medicine exactly how they've been told to take it. So the problem is if they think you're taking it, and let's say you should go into the hospital and then they actually put you on the dose of the drug that they think you're taking, not that you're actually taking, that can actually lead to serious consequences. And so it really, you want to develop a good relationship with either your pharmacist or your doctors, your nurses, to make sure that you feel comfortable telling them exactly what you're doing, because they can't help you make changes to your medication regimen if they really don't know how you're actually taking your medicines and what you're exactly taking. So write down your questions, make sure they're answered before you leave. And this is, again, the benefit of having a clinical pharmacist, where that's all they do all day, is they can take 30 minutes or 60 minutes of time to sit down and go through each one of your medications and answer all of your medication therapy questions. So there is something you can do, though. When you go to your community pharmacist and you get a new medication, there's a bunch of questions you should be asking. They're going to be there to counsel you, but there's probably a lot of other questions in your mind that oftentimes you don't ask. And so I've got a list of questions on this slide. And in fact, if you go below, there's actually a website that you can print out a copy of these questions and a few more. But some of the most important things that you should ask are on this slide. And one of the most important one is on the second column here, the question about, when will this medication start working? How should I expect to feel? Meaning, am I going to have side effects or possibly, or how will this make me feel better? It's really important to understand what the expectations should be. So that's a very important question to ask. Step 4 in terms of this process, make sure you ask for an updated medication record. So it's important if you have a new medication added that it's added to your list. If they've made changes to something else, that it's updated so you know exactly what you should be taking and how often. And step 5, you need to share this record with all of your team, because everybody needs to know all the medications you are and exactly how you're taking them. So right now, if you don't have that kind of clinical pharmacist and you don't have access to one, it's really up to you and your care, partner to help do this and make sure that your healthcare team has your updated medication list. Of course, there are paper medication lists that you can get. Many of the health systems, probably if you're going to a dialysis unit or transplant clinic, they'll have available paper copies of where you can write down your medications. But if you love your smartphone and love those apps on your smartphone, there are some good apps out there that you can put in your medications and keep a constant updated list. There's a number of them I've listed at the top that are rated as most trustworthy. One of my favorite, in fact, the one I use is the MyMeds app. It is nice that you can list out your medications, how often you need to take it and when. It gives you the reasons that you're on the medication, so that's helpful. It also, if you want to, it sends you daily medication reminders by text or email to remind you to take your meds. And the nice thing about it, this list can be shared with caregivers and your healthcare team so you can keep everybody on the same page. I do want to note that none of these apps are specific for dialysis, transplant, or chronic kidney disease patients. And sometimes there's little things in terms of the reasons for taking your medications that might not be quite exactly why you are taking them. It would be nice, and I hope that somebody takes this on someday, to create a nice app for kidney disease patients. So this leads me to the last piece that I really need to talk to you about, and I really need your help on, and that is advancing American kidney health through optimal medication management. You may have heard of the Advancing American Kidney Health Initiative through our government, and that has initiated a whole bunch of programs as well as some new care models that will be going into practice in the next few months that will help nephrologists, so kidney doctors and dialysis partners and transplant clinics, to work more seamlessly across that, we call it the care chasm, that disjointed care that you oftentimes feel like you're experiencing, to make things smoother for patients. But again, what we want as part of that is that every patient with kidney disease receives optimal medication management through team-based care, which includes a pharmacist, to ensure that your medications are safe, effective, and convenient for you to use. Our mission for our initiative is to engage pharmacists and key stakeholders. The main key stakeholder is you and your care partners, as well as policymakers, nephrologists, so kidney doctors, primary care physicians, nurses, to develop partnerships to optimize medication management in persons with kidney disease. Whole idea is to improve health outcomes so you can lead the life that you want to lead, and ultimately to reduce healthcare costs. So, key, you need to be an active member of your healthcare team. What can you do? I want you to advocate for a clinical pharmacist to be part of your team. So that means talking to your primary care physician, your nephrologist, to see if within your insurance and with your healthcare system, do you have a clinical pharmacist that could routinely see you to help you manage your medications? Also, which is very helpful, I would like you to advocate for having every person with kidney disease having a clinical pharmacist. And in fact, what is so important, if you've had a pharmacist help you with your medication therapy problems, I want you to share your story with me. I've put my email address down there. So if you feel comfortable, you could share your story directly through an email. If you feel more comfortable about talking to me, just send an email and then we can set up a time to talk. Those stories are important. Stories are what convince policymakers, other decision makers like dialysis providers, your nephrologist. Everybody responds better if through patient stories. If there's a problem, that can help connect the dots and be the first to inspire changes. Thank you for listening to me today about talking about how a clinical pharmacist could be a part of your care team.
Thank you, Dr. St. Peter, for an excellent presentation. Before we conclude, I would like to ask you the following question. Dr. St. Peter, your interest in elevating the role of pharmacists on the patient care team has been extremely well received by kidney patients and caregivers. For AAKP patient members, how can we be most helpful to you and the initiative to move the ball forward?
That's a really good question. And I really thank you for that question because we need help. First, as I noted before, I want you to be your own self-advocate. I want you to ask for a clinical pharmacist to be involved in your care to help you manage your medications. The second thing is advocate for others. It's very important to understand that there's lots of patients with chronic kidney disease, millions in the United States, those that have transplants and then with dialysis, that it's important to advocate that for others. And thirdly, I think if you have a real passion about advocating for others, either at your local level or the national level, then you need to get a hold of me. Please use that email from the previous slide to get a hold of me and let me know you want to engage on a higher level, because we need consultants to our initiatives, some work group members, and we need advocates to push for this. So we have pharmacists throughout the country that each of you could have access to.
On behalf of AAKP, we appreciate you taking the time to share your insight and expertise.